Hi, my name is Kevin Noel, and I'm going to be doing the subcutaneous injection video here. So to start off, we want to gather all of our materials. For a subcutaneous injection, we want to use a 1 to 3 milliliter syringe, usually 25 to 27 gauge. Do 3/8, 5/8 inch needle. In this case, I'm going to be using a tuberculin needle, which is acceptable for subcutaneous. It is a 5/8 inch needle with a 25 gauge needle. I don't have heparin, which is the diagnose or the prescribed order, so I have this, and I'll be going ahead and doing that now. So those are the required materials that we would need. We also need gloves as well and hand washing materials. The first thing we're going to do is verify the 6 rights of medication. So we'd want to go over the patient, the drug, the dose, and the route and the administration. So in this case, we want to verify the right patient. The right drug is heparin. The right dose is going to be 1,000 units, which is equal to 1 milliliter. And then we would want the right administration is going to be a subcutaneous injection. Documentation, we want to make sure we document everything. That way there's no double dosing or anything like that, or missed doses. So to calculate it, we would be doing the, again, 1,000 units. 1 unit is 0.1 milliliters, so that would be 1 milliliter would equal 1,000 units is what we're going to be going for here. First thing I would do is introduce myself to the patient. So hi, my name is Kevin. I'm going to be your patient today. I'm going to be using this right here for my injection video. After that, I would do patient privacy. So I go ahead and pull the curtain, make sure that we had our privacy and everything. Ask the patient if they have any allergies. That includes any food allergies, seasonal allergies, or medication allergies, anything else that they might have. We're going to inform the patient of the procedure, and we're going to go over we're going to be going over the medication. So we'd want to go over heparin, and we want to go over the uses, which it's a blood thinner, and it can cause bruising, it can cause pain, redness, warmth, irritation. Any of that can cause excessive bleeding as well. So we want to make sure that we explain to the patient that they're going to want to make sure that they are really careful with their cells, make sure they don't get cut or anything like that. We also want to let the patient know that if they are experiencing any side effects like that, they need to let us know immediately. We would let them know that burning or stinging sensation when you're administering the medication is completely normal, but any of those side effects that I listed, you would want to let me know if those were happening. Give the patient an opportunity to ask any questions. We go ahead and perform hand hygiene after that. So wash our hands about 30 seconds, keep our hands pointed down in the sink, warm water. Hopefully there's foot pedals in the office. Turn off the sink with the napkin if there is a hand one right there. And then we would go ahead and put on clean gloves. So for clean gloves, go ahead and put them on myself. And make sure we're not touching anything that is soiled or dirty or anything like that. So I'm going to go ahead and apply clean gloves. And then we're going to get the right gauge and the right needle. Again, we're going to use a 25 gauge needle, 5/8 tuberculin needle on that. So I'm going to go ahead and remove the cap here and then put the safety on. All right. And then we would want to take an alcohol pad here, and since the vial is already open for the medication, we're going to wipe that off. And the reason we're doing that is to keep it clean, so when the needle touches it, it doesn't touch anything that is contaminated. So I want to go ahead and wipe that off. Put those in the trash can. All right. And now we're going to want to we're going to fill the syringe with the medication. That's the next step, right? Yeah, remove the cap, wipe it up, yes. So in this case, we're going to want to fill it with the same amount of air. So since we're filling with 1 milliliter, we're going to pull this back to here. And then we're going to want to go ahead and fill that with 1 milliliter of air in the vial. And then we're going to go ahead and draw back our medication. So again, we're going to go ahead and draw 1 milliliter out in this case. Okay. All right. So we have 1 milliliter drawn up of this medication. And we're going to want to remove any bubbles or anything in the syringe, any air bubbles or anything. We don't want to put that into the patient. Again, we want to do 1 milliliter would be equal to 1 milliliter of medication would be equal to the 2,000 units. So what we're going to do is we're going to take our patients here, and we're going to put this down a little bit. Okay. So we're going to want to inspect the skin. We want to make sure there's no bruises, inflammation, edema, anything like that. Normally for subcutaneous injections, we're going to be looking at the lower stomach, or we're going to be looking in the arms or the legs. But for the purpose of this, we'll say that it's in the stomach. It's an easier place to do it. It's kind of recommended for that. So, all right. So again, checking for any bruises, inflammation, edema, anything like that, and making sure we don't have any of that. So we're also going to palpate the site and just make sure there's no masses or tenderness or anything like that in there, and just making sure that the injection site's going to be good to use. If we were doing insulin, we'd want to make sure that we were rotating the sites and stuff like that as well. So to make sure that the needle's the right size, we'd want to go ahead and pinch the skin. And you want the needle to be about half the size of the skin that you're pinching. So that would help you determine what size you're going to use. You'd basically measure the pinch skin that you have from top to bottom and go from there. We would then clean the site with an alcohol swab. So we're going to go ahead and clean this out. When you're doing with an alcohol swab, you want to start in the center, and then you want to go ahead and go out in about a 2-inch diameter. Make sure that it's nice and clean in a circular motion. Once it's clean, go ahead and get rid of the alcohol swab, and then you're not going to want to touch it, of course, or blow on it or wave it or anything like that. You want to dry on its own. And once the alcohol is dried on its own, you want to go ahead and hold the needle between your thumb and your forefinger, kind of like a dart. You're going to want to go in at a 90-degree angle, and you're going to want to go in pretty quickly. You want to go right in. So you go ahead and pinch the injection site here, pinch it, and then you go ahead and go right in. Once it's in, we're going to go ahead and we're going to hold the needle with our non-dominant hand just to stabilize it. Then we're going to go ahead and inject our liquid slowly. So the reason we're doing it slowly is because we want to make sure that everything gets administered in there and it's nice and gone. And basically should take about 10 seconds for everything to go out. Once it's drawn, once this is done, we're going to go ahead and remove it, put the cap on. We're going to hit it with a gauze right here. We're not going to massage or anything. We're just going to place the gauze or the alcohol swab just gently over it. And then we would put a Band-Aid or something over the site to make sure that it was okay. We, again, would not recap this. We would just put the safety on it, and then we would put it in the sharps container, which is a red container that's usually in the room. And then we would go ahead and remove our clean gloves and go ahead and do hand hygiene. So rewash our hands, use hand sanitizer, and then we're going to document. Now, when we document, we're going to want to make sure that we put everything that we did. So the patient, the medication, the dose, the administration, everything like that. We want to make sure that that's in there and that all of that is accurate. We want to do it immediately after administering the medication. That way there is no mistakes in double dosing or not dosing or anything like that. And that's it.